Good evening, everyone, and thank you for joining us to celebrate National Rural Health Day. My name is Natalie McGee, and I'm honored to be the incoming chairperson for Lucas County Health Center's Board of Trustees. I'm thrilled to welcome you to Lucas County Health Center's second annual Community Update presentation. Tonight, we are not only celebrating the essential role of rural health, but also discussing the ways our healthcare landscape here in Lucas County is evolving to meet new challenges and opportunities. At Lucas County Health Center, every member of our team, from frontline staff to our Board of Trustees, is committed to providing our community with quality care. We understand the unique needs and strengths of rural health care, and we're excited to showcase how we are continuing to adapt and grow to meet those needs. From enhancing the variety of services available locally to investing in new technologies and preventative care, LCHC is focused on ensuring that high-quality healthcare is accessible right here in Sheraton. Tonight, you'll hear from local healthcare leaders who are passionate about the work they do and who are striving to advance health in rural Iowa. Our speakers tonight aren't just representing healthcare organizations, they're advocates for our community and champions of the vital role rural health plays in everyday lives. Before we begin, I want to invite you, our viewers, to participate actively. Whether you're watching live or viewing this video later, we encourage you to share your feedback and ask questions. Your voice is an essential part of our ongoing journey to improve healthcare in Lucas County. As we continue tonight's program, I'm honored to introduce our next speaker, Darci Alt. Darci is the Mental Health Director and CEO at Heart of Iowa Region, an organization that plays a critical role in supporting the mental health and well-being of our residents. Her leadership and dedication have made a meaningful impact in Lucas County and beyond. Please join me in welcoming Darci as she shares more about the important work being done to address mental health needs in our community.
Thank you, Natalie, for that wonderful introduction. As she said, I'm Darci Alt with the Heart of Iowa Community Services Region, and we are a 13-county region in central and southern Iowa. We are responsible for many things. We have a wide menu of services and funding that we provide for. We actually, when it comes to funding, provide for non-Medicaid services. We are what we consider a gap filler. So if you meet our eligibility, which is residency in one of the 13 counties that we serve, if you meet our income requirements and diagnostic requirements. And as I said, we are MHDS, and what that means is mental health and disability services. So if you have a diagnosis that meets one of those requirements, we can most likely serve you. Heart of Iowa operates under a no wrong door policy. So if you are not sure if we provide a service that you are wanting to access, that's fine, call us. We will walk you through what you need, and we will try to reduce the calls that you make. If we are not the person that you're seeking, if we're not the provider of what you are needing, we're going to make those calls for you so that you don't have to make multiple calls. We understand that it gets very, very tiring to call person after person after person. We understand it's a struggle, and that after you've called 4 or 5 people, you might not want to make those calls anymore, and therefore you might not get what you're needing. And so we don't want you to give up. We want to help you make sure that you access the services that you're needing. So, what do we do? Question might be, what don't we do? But let me tell you about it. So, we provide service coordination. That could be any number of things from age 0 to 99. If you need help accessing work services, community living services, household services, home health aid, food delivery services, any number of things, we can help you figure out what those needs are. Maybe you don't know what you need, and one of our service coordinators can help you figure out if it's you or a loved one, what is that service that you're needing? We're going to help you figure it out. So, children's navigation is another service that we also provide. We help from kiddos 0 to around 21 years of age if they're in the school. We have staff that go into the schools, work with the schools. We do IAP services. We help set up behavioral health services. We can sit in on meetings, and we also ensure that if the school is interested in having therapists within the schools that children and families can access. We are able to provide funding for those therapy services, coordinate who those therapists are that are coming into the schools, and figure out how to make all of that possible. We're pretty excited that we can offer therapists in the schools and want to make sure that that's accessible for everybody. We also, if that's not what you're wanting, we can ensure that transportation is available to get kiddos from home to therapy appointments, from school to therapy appointments. What we need, though, is for parents to cooperate with us to allow all of that to happen. Schools have been wonderful with working with us, and we're really excited about those partnerships. We also are able to offer wraparound services for children and families. So if we start working with a child and we realize that there's another family member in the home that needs a service, we're able to offer that service to family members as well. So the other things that we do, jail services. We have coordinators that are in the jails. They're in there daily assessing anything that individuals in the jail might need. It starts with the screener upon arrival of that individual into the jail, and then it may be therapy while that person is in jail. It may be SUD services while that person's in jail, all the way to coordination in the courts to follow along services afterwards. Say an individual needs to go inpatient into SUD services from the jail. If it's something that the court requires, we can help coordinate that. We have transitional living programs that individuals can access where our staff follow along. Our ultimate goal is to reduce recidivism. We have had some really fantastic outcomes where somebody may have been in jail for 60 days, 1 year, and has never gone back to jail. So we keep track of all of that. We track our data, and our ultimate goal is to ensure that we hook people up with services so that they are not going back to jail. We ultimately want to ensure that if it's a mental health issue, that was really the underlying cause that created the issue that that person ended up going to jail for, that we're really treating that issue so that they're never going back to jail. We have a service and benefits navigator that helps individuals get set up with their Social Security benefits. She will take it from point A all the way to Z with you. She'll help you fill out your Social Security paperwork, help you with your appointments, so that if you're entitled to SSI or SSDI, she will work you through everything that you need. And she's specially trained so that the process doesn't take so long to get your Social Security benefits. We all know that it's a tedious process, but we try to make it easier. So she can meet in person or by Zoom, depending on where you are within the region, to make it as easy as possible for you. She also will work with you on your Medicaid. Every person that walks through the door, if we identify that you're possibly if you're possibly appropriate for Medicaid benefits, then we want to get you hooked up with whatever benefits are appropriate for you so that you can get your insurance, you can get whatever benefits you're entitled to. And that's one of our first steps that we take with everybody. We want to make sure that you have the coverage that you need. We work with hospitals in every county in our region. If you are suddenly hospitalized for a mental health issue or anything like that, we're going to follow you from the moment you walk through the door and we identify that you're there throughout a hospitalization and beyond. If you have a court process, we're notified about it in our office, and we want to make it as easy as possible for you. So if you go through a 5-day hospital stay or beyond that, the hospital notifies us and we begin discharge planning right away. So we're aware of you, and if you suddenly want a service coordinator involvement, or depending on what's going on, you may hear from us, and we may be working on getting you hooked up with an entire team of people so that it keeps you out of the hospital. And that's our ultimate goal, to get you those community services that you need to ensure that you don't have that revolving door cycle of constantly going back into the hospital. We also have a wide network of crisis services available within the Heart of Iowa region. We absolutely work with everybody within the region to have trained law enforcement officers in a 40-hour CIT program. We train all of our crisis providers in the same programming so that everybody is speaking the same language. And our Crisis Stabilization Center, which is located in Woodward, Iowa, everybody has access to that, and you can stay 3 to 5 days. If you don't have insurance, such as Medicaid, that covers that stay, then the region covers that stay. And we want to make sure that people don't feel stressed about a payment mechanism for those services. There's no prior authorization to going. You have that available to you through either self-referral, hospital referral, mobile crisis referral, law enforcement referral. There's no wrong door to access that service, and you can stay there as many times as you need to, however long you need to. It's just one of those things that we can do to help avoid a lengthy hospital stay and help people stabilize to get any avenue of service that they need to. And mobile crisis. We have mobile crisis available throughout the 13 county region, and that's available by calling an 800 number, which is located on our website. Law enforcement knows how to access it, our hospitals know how to access it, and you personally can access it any time that you need it, whether it's just a phone call to somebody or you need them on site with you. They have an hour to respond, but I know that our response times have been much quicker than that, and they can either assist you in stabilizing where you're at, bringing you much needed resources, or if you feel like you need to go to crisis stabilization, they can take you to crisis stabilization. We fully support them, and we can assist with lining you up with service coordination while you're there and beyond, or if you just needed that stay, then that's all you need. But all of these services can be found on our Heart of Iowa website, and that website is at hicsiowa.org, and I encourage you to check it out. Our next speaker is Mary Grismore with Lucas County Public Health, so we'll let Mary take it away.
Thank you, Darci. It's a privilege to be here this evening. For those who may not know me, my name is Mary Grismore, and I am the Public Health Nurse Administrator for Lucas County. At Lucas County Public Health, we focus on promoting well-being, preventing disease, and improving the quality of life for everyone in our community. Our programs address a variety of needs, from childhood immunizations to adult health education and community safety initiatives. Each service is designed to support health and wellness in meaningful and impactful ways. For instance, vaccination programs are a cornerstone of what we do. Through the Vaccines for Children program, we provide no-cost vaccines to eligible children, ensuring that all kids, regardless of their circumstances, have the protection they need to stay healthy. We also participate in the Iowa Vaccines for Adults program, which offers free vaccines to uninsured or underinsured adults, helping to reduce gaps in vaccine coverage, especially in rural areas. We also focus on safety and prevention. Through our Stop the Bleed program, funded by the Public Health Emergency Preparedness Grant, we provide life-saving training and resources. Bleeding is the #1 cause of preventable death after injury, and this initiative empowers community members to act quickly in emergencies. We partner with local organizations to train staff and place emergency kits in key locations, including schools and public facilities, so our community is better prepared. Another way we promote wellness is through programs like A Matter of Balance, a fall prevention workshop for older adults. Falls are a significant concern for seniors, but this program helps participants build strength, confidence, and independence. Through partnerships with organizations like the Senior Center and Lucas County Health Center's Physical Therapy Department, we've been able to make a real difference in reducing fall risks and improving quality of life. We're also proud to support youth leadership and advocacy through our iStep program, a statewide movement led by young people taking action against tobacco. At both Sheraton Middle School and high schools, iStep empowers students to educate their peers and advocate for a healthier tobacco-free future. These are just a few examples of how Lucas County Public Health is working to make a positive impact. Every program we offer is designed to meet specific needs while fostering a sense of community. And let's not forget the power of collaboration. None of this work would be possible without the partnerships we have with other organizations in Lucas County, including Lucas County Health Center and Heart of Iowa Region. Together, we're able to make a bigger impact and bring a wider range of resources to our community. Our partnership means that whether you're looking for preventative care, specialized medical services, or support with everyday challenges, there's a network of people working to support you. Thank you for allowing me to share some of the work we're doing at Lucas County Public Health. It's an honor to serve this community, and I look forward to many more years of helping Lucas County thrive. Now it's my pleasure to introduce someone who shares our commitment to rural health care and community well-being, Brian Sims, CEO of Lucas County Health Center. Brian will talk about how Lucas County Health Center is moving forward to enhance health care for our residents, and I know he's just as excited as I am about the future of health here in Lucas County.
Thank you, Mary, and thank you for all those who are viewing our annual update on National Rural Health Day. Since 2011, the National Organization of State Offices of Rural Health has designated the third Thursday of November as National Rural Health Day to celebrate the power of the rurals. This day brings attention to and honors the incredible dedication of rural healthcare providers, communities, organizations, state offices of rural health, and other advocates dedicated to addressing the unique needs of rural America. At Lucas County Health Center, our team of more than 200 professionals is committed to ensuring our patients and their families feel just a little bit better going out the door than when they came in. This philosophy, combined with our mission statement to promote and enrich the health and well-being of those we serve, and our core values of stewardship, excellence, dignity, hospitality, integrity, and teamwork, keeps us focused on you and is the guiding light for our strategic plan. The 4 points of our strategic plan are the patient experience, the employee and provider experience, the community experience, and financial stability. Let's dive into those a little further and reflect on the progress we've made this year. First, the patient experience point focuses on LCHC's commitment to improving and aligning our quality outcomes with patients' perception of care. In 2019, Lucas County Health Center was proud to be recognized as one of the top 20 hospitals in the nation for quality of care, a tradition of excellence we continue today. Most recently, LCHC was still ranked in the top 15th percentile of all rural hospitals nationwide. To continue with this success, we've created a focused investment strategy to enhance our services. Over the past year, we've renovated our emergency room, acquired state-of-the-art chemical analyzer for our lab, and approved the purchase of a cutting-edge CT scanner that uses artificial intelligence to provide a better scan interpretation. These upgrades represent the best technology available and are designed to deliver superior diagnostic results and treatment capabilities. In the last year, we've also welcomed 3 new providers: Dr. Zach Johnson in family practice, Dr. Casey Joe, our general surgeon, and Darci Fuller, our nurse practitioner, and she's our hospitalist and works in the emergency room. All 3 have proven to be great additions to our already amazing professionals. The second point is our employee and provider experience, which focuses on creating a patient-centered culture where providers and employees work together to serve our communities and become the healthcare employer of choice. Like many healthcare organizations, we deeply value our employees and their dedication to providing exceptional care. We strive to eliminate barriers and empower our professionals so they can provide you with the best care possible. Day after day, our staff demonstrates unwavering commitment to our patients, facilities, and community, and our leadership team strongly believes in honoring and supporting them for all they do. One of the ways we achieve this is by offering competitive pay and benefits, including our newest benefit of semi-annual retention bonuses. Because retaining staff has become more difficult post-pandemic, our focus on the employee and provider experience is more critical now than it has ever been. Our third point is the community experience and our commitment to increasing the awareness of services while upholding trust within our community. Over the past year, we've expanded our outreach through social media, print advertising, billboards, digital advertising, and more. We've also launched video initiatives like this one and our quarterly YouTube series, House Call, which is intended to give our community an opportunity to learn more about the services, providers, and general happenings at Lucas County Health Center. If you haven't already, I encourage you to visit our YouTube channel to learn more. We'll have a link at the end of this presentation. Finally, our fourth pillar is financial stability, which highlights our commitment to achieving a 3% margin at the end of the fiscal year. To meet this goal, we must be good stewards of our dollars. In healthcare, there's a well-known phrase, no margin, no mission. Without a positive margin, our ability to renovate our facilities, purchase new equipment, and provide competitive pay becomes a significant challenge. For example, the recent remodel of our emergency room was completed by our facility staff at the cost of $60,000. If we had used an outside contractor, it would have cost more than $200,000. Similarly, the new chemical analyzer I referenced earlier was a $250,000 investment for our lab, while the advanced CT scanner we have approved was well over $700,000. Additionally, just the IPERS contribution on behalf of our employees will cost Lucas County Health Center approximately $1.2 million this year, a figure that does not include any other benefits such as health insurance. But thanks to a new federal government program, LCHC exceeded its financial goals by $2 million, further strengthening our ability to support our mission and serve the community. All of this brings me to another topic. I'm pleased to report that the Lucas County Health Center has reestablished its own foundation. To my knowledge, we were one of few hospitals in the United States without an active foundation. As we look to the future, the foundation will play a key role in shaping our growth. By raising awareness, securing annual donations, building relationships, and fostering planned giving, the foundation will help address our evolving needs and ensure we can continue to meet our mission of promoting and enhancing the health and well-being of those we serve. I want to say thank you to those inaugural foundation members, Denny Bisgard, Ken McCormick, Marion Holmes, Natalie McGee, Lisa Junkman, Lori Johnson, Christine Kennedy, and Gina Wiley, for their commitment to getting our foundation up and running. Finally, I want to say thank you to our Board of Trustees, providers, senior team, department heads, volunteers, and staff for keeping the focus on the communities we serve. The past 4 years have not been easy on healthcare, from navigating a pandemic to adjusting to the new normal, but our team keeps coming back and giving their all to serve our community. And for that, I could not be more thankful. I believe the future for Lucas County Health Center is bright, and I'm very proud of the work we do in support of rural health. I hope you are as well. As we conclude tonight's update, I want to remind you that your voice is an important part of the progress we make. If you have any questions or feedback, I encourage you to send it to Gina Wiley, whose email address will be listed below. Until next year, stay healthy, and if perchance you do come down with something, know that Lucas County Health Center is here to take care of you. It really is care that feels like family. Now back to you, Natalie.
Thank you, Brian, for providing such a thoughtful vision of the strategic direction Lucas County Health Center is heading to meet the ever-evolving healthcare needs of our community. The compassion and dedication of your team shines through in everything. As we close tonight's community update, let us take a moment to reflect on what rural healthcare represents for each of us. It's more than a response to unique challenges. It's a testament to the strength, resilience, and deep compassion that lie within our community. This evening, you've witnessed firsthand how rural healthcare can and will continue to thrive, especially when we work together. I'd like to encourage each of you to consider what you've learned tonight and think about what rural healthcare means to you. Whether it's by sharing resources, volunteering, or advocating for a better tomorrow, each action we take has the power to strengthen Lucas County. Once again, I'd like to extend gratitude to Darci, Mary, and Brian. I know all our organizations take immense pride in the strong relationship between Heart of Iowa, Lucas County Public Health, and Lucas County Health Center. It is the strong partnership that allows us to work together toward a common goal. improving the health and wellness of our communities. To our audience, thank you for joining us this evening. Your support means everything, and we hope you leave here with a sense of determination, just as we feel, to keep rural health care a priority. Together, we can shape a future where quality, compassionate health care remains accessible to all our community. Thank you and have a wonderful night.